Because it is one among the Dashamulas, the group of 10 roots. Do you have any preference like when to pick Dashamoola versus Gokshura, or can it be replaced or substituted? Dashamoola versus Gokshura.
No, it is not a right type of combinations that we cannot simply, in places where we are supposed to use Dashamoola, I can use only Gokshura. That is not right. Dashamoola has its own role. Dashamoola is Tridoshamaka. The drugs present in the Dashamoola is Tridoshamaka, whereas Gokshura is simply a Vatashamaka and Kaphavardhaka, to some extent Pittashamaka. So it cannot be replacing the Gokshura, cannot replace the Dashamoola.
Charuji asks, does this help in adrenal fatigue?
No, we need to understand adrenal fatigue means then what exactly the things happening and what are the lakshanas present in the patient. Many a times it so happens just because of some branded diagnosis, we cannot simply go with some drug using there. We need to understand what are the lakshana, what is the problem, the presenting complaint of the patient. It may be a fatigue or what it is. It simply won't, and if it is these type of bigger, yapya type of diseases or asadhya type of diseases, just don't think that which can be handled by using one single herb or something like that. No, that cannot be. That is not possible. We need to understand that what exactly the things are happening and what is the presenting complaint of the patient. Based on that, whether we can use it or not, we can decide it.
Yes, and adrenal fatigue is not a kind of a standard disease. It is just naturopaths use this term. Better analyze the underlying cause, shrama, klama, what the patient has, and which particular organ in the body. Better to analyze the disease only than come to an Ayurveda diagnosis just rather than just vague. Point well taken, sir. And next question, Pradeepaji asks, for ideal Bhedana property, is Gokshura de Gugulu is a better choice over Gokshura Ksheerapaka? How to select ideal form of a herb? Does it depend on both the Roga and Rogi?
See, it's very clear. We don't use the term simply as it is Bedana. Whenever we use the term Bedana simply without any prefix or anything, then we think that it is a Mala Bedana. So it is not the Ashmari Bedana. If you want to be specifically Ashmari Bedana, then you have to say that Ashmari Bedana. Otherwise, if simply Bedana means it is for the Mala Bedana purpose, and Katuki is the best drug for that Mala Bedana purpose. So when for the purpose of renal calculus or Ashmari Bhedana, if you are asking about, which is the best one, you can use the herb Gokshura in whatever the better way it is available to you. If it is Gokshura the Kada, okay. If Gokshura Adi is not available, only Gokshura is available, okay, you can prepare it and do it. But in this case, when there is a crystallization and calcium oxalate are the things which are helping to form into stones or the kidney calculus, it is better we should avoid Ksheerapaka here. Ksheerapaka should not be a right kind of combination or a drug. Here it is better Kashaya should be given. Or even Gugulu is also no problem. Gokshura the Gugulu or Ashmari Harakada or Mutra Lakwata or even Gokshura the Kwata, something like that can be given instead of that. Only we go for Gokshura the Ksheerapaka or Gokshura Ksheerapaka, particularly in case of third trimester pregnancy. So that can be done or used as per the need. That is only for the purpose of removal of the shotha and during that time, and it should be nourishing. So that's the reason that's why Ksheerapaka is given. But Gokshura Ksheerapaka, as it contains milk in it, and which is not a good combination in case of a calcium oxalate crystallization, which is taking place of Ashmaris, and we usually don't recommend them with any kshira or even all the preparations of the milk and milk products will be avoided to those patients of renal calculus.
Thank you very much, sir. Be very specific with Dravagana terms when you are talking to Dravagana professor. Point noted there.